Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here. Hey, everybody. Welcome back to the Fiat Health Podcast. My name is Caroline. I'm a nurse practitioner and co-founder of Fiat Integrative Health here in Franklin, Tennessee. And today I am joined by Ashlynn.
Hello.
Hello. She's also a nurse practitioner here. Both of us see whole family, primary care, sick visits, all things.
Everybody.
Yeah, it's so fun. I'm kind of laughing because I'm losing my voice.
And I'm sniffly.
And today we're going to talk about allergies.
Perfect timing.
It is definitely springtime here in Middle Tennessee.
Yes. You couldn't tell by the yellow covering everything.
Everything, all the cars.
Yep.
And this is the time of year that I tend to look high for like 2 weeks because my eyes get so bloodshot red. And we were just laughing the other day because I was telling everyone the story of how it was longer than 3 years ago now. We had been here for 3 years and I went to a walk-in clinic before I was a nurse practitioner and my eyes were killing me. And I wasn't really like sneezy or sniffly. I just felt like I got hit by a bus and my eyes itched a ton. And I went to the walk-in clinic and she was like, oh yeah, it's seasonal allergies, like take some Flonase. And I was like, what?
Really?
There's no way. I feel like I got hit by a bus.
Miserable.
Yeah. Come on, lady. And sure enough, that's what it was.
Yeah, I know. They can be rough. I've even seen a handful of patients who are like, no, this is something more. Like, I know it feels like it, but I promise it's allergies.
It's allergies.
Yeah.
I mean, histamine will kick you in the butt,
Really will.
So let's see. I think everyone knows what allergies are. You've got pollen and stuff.
Trees,
in the air.
Grass.
Yeah.
Flowers, even everything.
Animals, technically. Yeah, that's not seasonal allergies, but your body basically sees it as like, this is foreign. I don't like this. And it has a reaction of like, I'm going to create an inflammatory response because I don't like what I'm seeing here. This is a foreign invader. And then we get all the allergy symptoms, right? Itchy eyes, runny nose, sneezing, and all that fun stuff.
Yeah. And the feeling of being hit by a bus.
Yeah, exactly. Obviously, there are some we're going to get like straight to the practical for everybody out there, all you allergy sufferers.
Yep. Easy things.
Yes, there's some easy things you can do at home to just help minimize your symptoms. It's not going to take them away. But the more we can just like skim off, 1%, 2%, all of that adds up to then maybe we're moving the meter a little bit, that we're feeling a little bit better. What are some of your favorite things you like to do?
So, I mean, I know it's hard when the weather is like finally so nice and you just want to be outside, but the number one thing we can do is minimize our exposure.
Yeah.
So, minimizing, I hate to say minimizing time outside, but if you're really suffering, that can help.
Yep.
But when you do go outside or your kids, when they come back in, changing their clothes immediately, offering a shower, wet washcloth, something like that, just to like get all the pollen, get all the allergens off, are some just easy, straightforward ways. Other things you can do are adding like HEPA filters in your house to help, purify the air. Allergen covers for pillows, bed sheets. You have to, doing more laundry than you would probably like, washing things more often, just to rinse off all that pollen and all those allergens are really the easiest way to help minimize exposure.
So my brother growing up had terrible allergies. I swear he lived in the basement for months at a time. Poor guy, went through all the allergy shots and everything. And we'll see patients kind of in that like acute flare of like, we are miserable, especially kids. And so at that point, it's like, yes, let's just like calm everything down for a minute. Let's stay inside for a couple days. I mean, it doesn't have to be forever by any means, to calm things down. And absolutely wash the sheets, shower, obviously, hopefully. And then definitely doing the HEPA filter in the bedroom.
Mm-hmm.
I mean, if you think about it, we spend the most time in our bedroom sleeping. And so if that environment is full of pollen because we brought it in, or we got the window open because it's such a beautiful day, we're just like constantly triggering ourselves. And if your kids are like my kids and we're past that kind of acute phase and they're just outside all the time, which is great. I mean, it's so beautiful. How can you keep them inside? It's so hard. Then I usually, if my kids have any kind of allergy symptoms, will have them wash their hands and their face, when they come in from like being in the dirt and in the woods and just for all of that pollen. I know for myself the other night, I was like rubbing my eyes like crazy. It's like that, the scratch and the itch and like you can't help yourself.
Yeah, I know.
And just keep doing it until like your eyes are literally swollen and red.
It's
and
like the itch that can't be scratched.
Yeah. And it was like, finally, I was like, why don't I just go wash my face?
Yeah.
And I washed my face and my hands and I was like, okay, I'm better.
Yeah. Mm-hmm.
That's all it took.
Yeah.
That's all it took.
Yeah.
So funny. So yeah, those are definitely the ones whenever I see patients, I'm like, absolutely put a HEPA filter in the bedroom.
Yep.
They're cheap on Amazon.
Very. And they last
for that
forever.
For that little room size one.
Mm-hmm.
And washing the sheets like every day if your kid's really, really symptomatic or you, at least a pillowcase.
Right.
I mean, that's going to hold the most stuff, especially if they're not showering every day. Definitely helpful. Awesome. So that's minimizing exposure. There's a couple things you can do just in your diet to kind of, again, because your body's having this big inflammatory response, if we can do some general anti-inflammatory things, right? So like it's not taking away the exposure. You're still getting exposed. Your body's still going to have this reaction. But if we can calm that inflammatory response, then that could help. So a big thing would be anti-inflammatory foods. That would be berries, leafy greens, fatty fish that are rich in omega-3s. I mean, just the general like avoid processed foods.
Which we've probably discussed a million times.
I know, right?
Yeah, just like overall wellness, immune
lean
support.
Your diet up. This is a good time. If your kid's really miserable, you might want to avoid a lot of sugar. You might limit things significantly. I would personally take out dairy and gluten for just a little bit. We're really miserable because those are just known inflammatory foods. Even though I don't love restricting kids, it's like we want to get that inflammation down. What else can we do?
Local honey is a great resource. We've talked about honey all the time for many different uses, but there are some studies that show that local honey can potentially desensitize your immune system to pollen, right? Because bees produce pollen, produce honey. So local honey starting a few months before allergy season can help. Local is the most important part. So it's not like you go to the grocery store and you see raw honey on the shelf. You're like, oh, that has to be good. I mean, it's like made in California or made somewhere.
Yeah.
So buying local is the best. So like at your local farm stand, farmer's market, neighbor. I mean.
Yeah. So my husband used to keep bees. He would love to still have them. And maybe we will one day when we're not drowning in children. But I will say that, you have, obviously I learned a lot about honey when we kept bees. And you've got a fall harvest and you've got a spring harvest. And so even that, if you're like, I have spring allergies and not fall allergies, then you actually want to like have the spring honey. And so sometimes too, like if you're the kind of person that this comes every year you're suffering from allergies, I would buy some massive bulk of local, spring honey, if that's what it is, to be able to start it. Like, I mean, I would say the whole year round personally, but really like at least 3 to 6 months is ideal.
Totally.
Taking it every day. I mean, it's the same idea as, allergy shots or the sublingual therapy we'll talk about of like that constant, very small exposure is going to help build your immune system to say, oh, this isn't a threat anymore. This is something I recognize.
Right. Especially because, a lot of people are like, well, we just moved here from wherever, Atlanta or California or wherever they're from. And my allergies have never been this bad. Well, it's because you've never been exposed to these specific allergens in our region. Right. So,
and sometimes it'll be that second or third year in.
Right.
Like for me, it was like I never had allergies. So we were here for 3 years. And it was like, oh, like after so much exposure, your body creates those antigens that are IgE response. And so you may be like, but I've been here. Yeah, that's also very normal.
Yep. Yep.
Okay, great. A couple other things you can do. Obviously, drink lots of water, prioritize sleep, good lifestyle things to do in general anytime you're sick or not feeling well. And then also just a low histamine diet. So this goes along the same as like an anti-inflammatory response. We're not necessarily decreasing the amount of histamine that's produced in your body from an allergen perspective, but if we can decrease the amount of histamine produced from other things, then, we're decreasing that bucket, that load of histamine in the body overall, because our body reacts to other things too on a lower level. So our body is always producing histamine to a degree. We just don't really recognize it. So a couple of things that you can do with that to decrease the histamine is avoiding fermented foods, aged meats. Certain vegetables are naturally higher in histamine and trigger histamine in our body. So that would be like spinach, tomato, certain fruits like bananas. If your kid is like my kids who would love to eat 3 bananas a day, maybe we lay off the bananas a little bit. And then also like pickled foods and vinegar, chocolate. Unfortunately, I'm so sorry. And then leftovers. So the longer food sits, the more histamine it produces.
Mm-hmm.
So the fresher the food, the better. And then of course, you can Google more and more things that you can find that create histamine, but those are kind of the top ones I'd say to avoid. Awesome. What would you say then is some things that are evident, have been studied to these things absolutely help allergies, and they're not allergy shots and they're not Zyrtec?
Sure. So, like we said, you can do all these things we mentioned, but allergies are just rough and they're going to hit you. So some things that can help alleviate some of those symptoms. Easiest thing is saline rinses. So kind of along the lines of like taking a shower, washing your face when you come in from outside. Saline rinse can be really helpful in essentially doing the same to your nasal passages. So rinsing all those allergens out. So we've talked about that before in other podcasts. We're huge fans of nasal rinses over here. We've got some great gnarly videos on how to do it on your little kids with these giant boogers coming out.
Yes.
So whether that's like with a syringe or the bottle or a neti pot, however you find easiest to do that. But there are some different herbs that have been studied for their antihistamine, anti-inflammatory properties. The first being quercetin. So, like I said, it's very anti-inflammatory. There's a lot of foods that are rich in quercetin, those anti-inflammatory foods, like we kind of already discussed, those dark berries, grapes, olive oil, things like that. But we love quercetin in kids too, kids and adults, kids over 2 generally, but you want to make sure you're talking to a doctor about dosing for that. Stinging nettle is one of my favorites. It has compounds that can inhibit histamine release from mast cells. So talking about that histamine response, this can help inhibit that. You can consume it via tea, capsules, things like that. Love stinging nettle. I think of it as like a natural Claritin. That's always what I refer to it to because it's so powerful. And then bromelain, which we've talked about before, can really help with cough, but it's an enzyme that has anti-inflammatory and anti-mucolytic properties. When you're super congested, runny nose from all those allergies, it can help break down that mucus and inhibit inflammatory pathways. Finally, NAC, N-acetylcysteine, helps support glutathione, which we know is an antioxidant, can help support the immune system, the respiratory tract. There is a supplement that we love. We recommend to patients all the time. It's D-Hist. It has all those things in one. A couple different companies make it. D-Hist is one. Sinuplex is another. Sinotrol. There's lots of different names out there.
Sure.
But they do have it all in one. So if you're like, how am I going to give my kid all of those herbs? They make them in combos because we know how well they work together. We know that they're more effective when given together as well.
Yeah, and these are chewable tablets, which I also love, much easier to give to kids. I will say it is not the same as Claritin, or it's not as effective.
Yeah, not as effective.
If you've been on, a true over-the-counter medication for allergies and you expect it to do the same, it's not going to be the same. But again, what we're doing is trying to take a little bit out, little bit to hopefully move the marker. So this is definitely something that can help move it. And I think too, I love stinging nettle as a tea. I feel like kids are receptive to that. You add the honey in with it. It's like bonus 2 for 1. So great. And then 2, another thing we love to do is probiotics. And I will say, any probiotic is better than no probiotic. So if you're like, I'm so overwhelmed, what do I do? Culturelle, available, Kroger, everywhere.
Yep.
Comes in a little powder, comes in chewable tablets. That's great. What we love to look for in particular, if you read the active ingredients and the strains that are contained in a probiotic, lactobacillus and bifidobacterium in particular have been studied with allergies. Love to see at least 5 to 10 billion CFU per day. More is great, but if you're looking at one, it's like 1 billion, it's probably not moving the mark very much. And then 2, just along the lines of tea, is you can also add in chamomile, which is great. It can help soothe some of those more just anti-inflammatory, right? So some of those inflammatory symptoms.
Sore throat, cough, things like that.
Exactly. Great. What are some other things that we can do that for those people who are like, look, I've done all that.
Done it all.
I've got all that going and I'm still miserable.
Yeah.
Help me. I can't function. What are some things we like to do?
Yeah. So there's some over-the-counter medications that we use frequently. I use them frequently, especially in seasons like this. Sertrazine or Zyrtec, the green bottles, antihistamine works great. A note on that though, in some kids, it can cause a little bit of drowsiness. In adults, less so. But something to note there. And loratadine or Claritin, the blue bottle. So both antihistamines. Claritin is a little less sedating for kids. They work great. They work fast, which is why a lot of people like them. But I think something important to note with either Claritin, Zyrtec, or even the herbs that we talked about, consistency is the only thing that's going to really help. So you're like, I took a Zyrtec last week and it did nothing. Well, it's not going to, one dose is not going to do much.
Yeah.
Same with, any of the herbs, you have to be consistent with them. They only are effective when we, keep levels high in our system to help fight those histamines. So Claritin, Zyrtec are wonderful. A lot of people, their biggest complaint is like headaches, nasal congestion, drainage. They can't breathe through their nose, things like that. So I love using like a nasal corticosteroid. Some people don't like them. I love them. I think they're really effective in reducing inflammation in the nasal passages.
Yep.
But again, one dose of Flonase is not going to change how you feel. Yeah, Flonase has to be consistently used. And you can, increase it when you're super sick, feeling really bad. You can take it once a day, talk to your doctor about that. But I love Flonase. I think it's wonderful. Doing a nasal saline spray, nasal saline rinse, followed by Flonase is the most effective way to get it through your nasal passages. Can really help relieve that inflammation in your nasal passages, decrease congestion and pain, really, headaches.
I'd say with any of those, it's like I said, it's like, we add these in when needed. It doesn't mean you have to be on it for 3 months.
Right.
Get through kind of the worst of it, the peak, and then wean down. I would say typically with Flonase, it does take a week or 2, and with over-the-counter Zyrtec.
Notice.
Yeah, to really notice a big difference. Some people will see kind of that immediate relief, but more commonly like a week or 2 of consistent use.
Yeah.
There's some other fun things. So we're not going to touch too much on allergy shots. Those, I don't tend towards those because they are expensive. They are very difficult to do because you have to go to the office. Was it like once a week?
Sometimes they're up to 3 times a week, and you have to sit there.
And then you gotta get a shot,
get the shot, make sure you don't have allergic reaction. Then you can leave.
Yeah. So
I suffered through that as a child. So can't tell.
But there's some really cool kind of newer technology and therapies out there. One of which is called SLIT. Tell us about that.
So SLIT is a sublingual immunotherapy. That's what it stands for. And it's interesting because just like allergy shots, they're tailored towards each patient. But essentially, it's very low doses of the allergen. So an allergy shot is essentially just exposing your immune system to that allergen. So what they're injecting into your muscle is what you're allergic to, essentially. So a sublingual immunotherapy is similar, but you can do it in the comfort of your own home. There's significantly less reactions than there is to intramuscular injections of allergy shots. And over time, the idea is, just like we talked about with honey, to desensitize your immune system to the specific allergens. It's pretty cool.
Yeah, it's really cool. It's been used in Europe a lot longer than it has here. It's just kind of newer to the US, so it's less available or mainstream, I'd say. But there are places here in like Middle Tennessee that does it. I'm sure a quick Google search, you can find some places wherever you live.
Yep.
I think there's even some that are like completely remote, like.
Yeah, you can do it all over telehealth.
Yeah, all over telehealth, which is really cool. What was the other one that we were talking about?
Low dose immunotherapy. So I think the biggest difference between the two is that with the low dose immunotherapy, there's a little bit wider of things you can treat. So even with low dose immunotherapy, you can do even like milk protein desensitivity, things like that. That's really how they differ. I think the sublingual immunotherapy is more for generalized allergies, environmental allergies, trees, grass, pollen, dust mites, animal dander, and the low dose immunotherapy is used in a more variety of allergens.
Yeah, absolutely. I don't think we looked and nobody in Nashville in our area does that. Is that right?
I think so. I think there's maybe one place in Brentwood that does it.
Oh, that's right. The like integrative oncology place.
Yep.
Yeah. Okay. Well,
so unsure, but there's a lot of online resources, a lot of telehealth providers that do it.
Yep.
So yeah, I think it's a really excellent option, especially if you or your child are a longtime sufferer.
Right.
Of allergies and nothing's helping, and allergist is telling you just to increase your dose of antihistamine and it's still not working.
Forever and ever, and go get shots and all the things. There are other options.
Yeah, lots of other options.
Absolutely. Well, anything else to leave with our fellow allergy sufferers out there?
I think, we've both seen an uptake of patients in our office struggling with allergies. So when do you need to seek medical care? I mean, I think anytime, really. Just for guidance as far as what you should take, what you shouldn't take, things like that. But I think it's important to note that though this can make you feel really miserable, and we've talked about this with the cough and cold, do I have a sinus infection? Is this bacterial now? But with allergies, if we're not doing any kind of intervention, you're way less likely to have a sinus infection, right? You're just struggling with untreated allergies. So I think it's important to just talk to your provider about that.
Yeah, I think just setting expectations.
Yeah.
Especially if you're new to the allergy world.
Yeah.
First time sufferer, it's like, can I really feel this terrible? Yeah.
Yeah.
Yeah, you can.
Yeah.
Unfortunately. And it'll go away. It's a season.
Yep.
And I think what I call it your misery meter. Your misery meter is going to drive how much you're willing to do.
Yeah.
Are you willing to drink tea twice a day and take these things out of your diet and wash your sheets and everything? Like, yeah, if you're really miserable, like I'd be doing all those things. But if it's really mild, like for me, I just pretty much just suffer through it for 3 weeks.
Yep.
And then I'm done.
Right. But if you listen to our cough and cold podcast, we really dove into kind of like, when is this more serious?
Sure, yeah.
So if you want to go back and listen to that, it can be really helpful, even with allergies.
Yeah, totally.
Yeah.
Awesome. Well, it's been fun. I hope it is helpful to all you allergy sufferers out there.
Good luck.
Yes. And solidarity.
Yeah. We stand with you.
Yes.
In suffering.
And if you have something that was like super helpful to you that we didn't mention, like shoot us an email. We'd love to hear about it.
Yeah.
I love anecdotal evidence. I love real evidence and I love anecdotal evidence.
We'll try it. We'll try anything.
Yeah, exactly. Awesome. Well, it's been great. If you want to check us out, we're at fiathealth.org. I love my voice. It's just gone. And we'll see you next time.
See you next time.
Bye.
Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.